Top medical conditions that can impact fertility. Here's a shocking fact. Nearly 1 in 6 couples worldwide struggle with infertility, and in many cases, it's not just age or lifestyle, but underlying medical conditions silently making conception harder. The problem: most women don't even realize they have these conditions until they've been trying for months, or even years. Today, I'm going to walk you through the top medical conditions that impact fertility in women, how they affect your body, and the signs you should never ignore. Stick with me, because the last condition I'll cover is one most women don't even know can affect fertility, but it's more common than you think. Welcome back to Faith's Fertility Lab, where we dive into all things fertility, reproductive health, and empowering women to take charge of their bodies with science-backed knowledge. If you're new here, hit that subscribe button and turn on notifications, because I release videos every week to help you on your fertility journey. Section 1. Polycystic Ovary Syndrome, PCOS. Let's start with the number 1 most common cause of infertility in women, polycystic ovary syndrome, or PCOS. This hormonal condition affects how your ovaries work. Instead of releasing eggs regularly, the process is disrupted. You might notice irregular periods, weight gain, acne, or even excess hair growth. But here's the tricky part. Some women with PCOS have no obvious symptoms at all. Since ovulation is unpredictable, it makes conceiving naturally more challenging. The good news: lifestyle changes and medical treatments can help manage PCOS, and many women with this condition go on to have healthy pregnancies. Section 2. Endometriosis. Next is endometriosis, a condition where tissue similar to the lining of your uterus starts growing outside of it, on your ovaries, fallopian tubes, or even your pelvic lining. This can cause painful periods, pelvic pain, and sometimes heavy bleeding. But what most women don't realize is that it can also create scar tissue and blockages, making it harder for sperm and egg to meet. Endometriosis affects around 1 in 10 women, and while it can be frustrating, there are treatments, including surgery and fertility support, that can improve the chances of pregnancy. Section 3. Thyroid disorders. Now here's one that often flies under the radar: thyroid disorders. Both an underactive thyroid, hypothyroidism, and an overactive thyroid, hyperthyroidism, can mess with your menstrual cycle, hormones, and ovulation. Some signs include fatigue, weight changes, hair thinning, or feeling unusually hot or cold. Many women don't connect these symptoms to fertility, but your thyroid is deeply tied to reproductive hormones. A simple blood test can diagnose this, and treatment usually restores normal fertility. Section 4. Pelvic inflammatory disease, PID. Another condition you may not think about is pelvic inflammatory disease, often caused by untreated sexually transmitted infections like chlamydia or gonorrhea. PID can scar or block your fallopian tubes, preventing the egg and sperm from ever meeting. The scary part: sometimes PID has very mild or no symptoms until it has already caused damage. That's why regular checkups and STI testing are so important. Early detection makes all the difference. Section 5. Uterine fibroids. Let's talk about fibroids, non-cancerous growths that develop in or around the uterus. Depending on their size and location, fibroids can interfere with implantation or block the fallopian tubes. Symptoms may include heavy periods, pelvic pressure, or even frequent urination. Many women don't realize their fibroids could be the reason they're having trouble conceiving. Treatments vary, from medication to minimally invasive surgery, depending on how severe they are. Section 6. Diabetes and autoimmune disorders. Chronic conditions like diabetes and certain autoimmune disorders can also affect fertility. Poorly controlled blood sugar levels, for example, can disrupt hormones and affect ovulation. Meanwhile, autoimmune conditions, where the body mistakenly attacks its own cells, can sometimes interfere with implantation or pregnancy maintenance. While these sound serious, managing them with the right medical care can dramatically improve fertility outcomes. Section 7. The overlooked condition. And here's the one most women never think about: unexplained infertility related to stress and hormonal imbalances. Chronic stress doesn't just affect your mood, it directly impacts reproductive hormones like estrogen and progesterone. In fact, high stress levels can stop ovulation altogether. While it's not always the single cause, it often works alongside other conditions to make fertility even harder. So, as you can see, fertility isn't just about age or timing, it's deeply connected to your overall health. Conditions like PCOS, endometriosis, thyroid issues, PID, fibroids, and even chronic stress can all play a role. The key takeaway: if you've been trying for a while with no success, don't wait, get checked. Sometimes a simple test or treatment is all that stands between you and your fertility goals. If this video gave you clarity, make sure to give it a thumbs up and share it with someone who needs this information. And don't forget to subscribe, because in my next video, I'll be breaking down the everyday habits that secretly lower your fertility. Trust me, you'll want to know these.